Sputum culture, how doctors grow TB for testing. Imagine trying to catch a tiny, slow-growing bacteria that hides deep inside your lungs. That's what doctors do when they want to find out if someone has tuberculosis. They use a test called a sputum culture, which is like planting a sample in a special garden to see if the bacteria will grow. The first step is collecting sputum, which is the thick mucus you cough up from deep inside your lungs. To get a good sample, doctors usually ask for at least 3 specimens collected on different days, including one early in the morning because bacteria tend to be more concentrated then. Patients are instructed to cough deeply so the sample comes from the lungs, not just saliva, which doesn't contain the bacteria. If someone can't produce sputum naturally, doctors might use special techniques like inhaling a saline mist to loosen the mucus or perform a procedure called bronchoscopy, where a thin tube with a camera is inserted into the airways to collect samples directly. Once the sputum is collected, it's placed into sterile, leak-proof containers and sent to the laboratory. There, technicians inoculate the sample onto special culture media designed to support the slow growth of tuberculosis bacteria. Because these bacteria grow very slowly, it can take 6 to 8 weeks for enough bacteria to develop to confirm infection. During this incubation period, the samples are kept at around 37 degrees Celsius, which is close to body temperature, and checked daily for signs of growth. When bacteria are detected, lab specialists perform additional tests like microscopy, staining with acid-fast dyes, and biochemical assessments to confirm its tuberculosis. They also test whether the bacteria are resistant to antibiotics, which helps doctors choose the most effective treatment. The sputum culture is considered the most reliable test for diagnosing tuberculosis because it directly detects live bacteria, unlike other tests that look for bacterial parts or immune responses. However, it requires careful sample collection, sterile handling, and patience due to the slow growth process. If a person has started tuberculosis medication before the sample is taken, it can reduce bacterial numbers and make the test less accurate. That's why doctors often review medication history when interpreting results. In summary, to grow tuberculosis bacteria for testing, doctors collect deep lung sputum samples, place them on special media, incubate them at body temperature for several weeks, and then identify the bacteria through microscopic and biochemical techniques. This process provides a definitive diagnosis, guiding doctors to the right treatment plan. Always remember, if you suspect tuberculosis or have concerns, consult a healthcare professional for proper testing and care.